If we continue to develop research without engaging patients, we'll have good evidence, but patients won't understand it. We need to make sure that we engage patients early and often so that the research that we perform is meaningful in the end. In order for patients to understand research, we feel that if we ask them to help us think through how to frame our questions and how to frame our answers, then other patients will benefit. There are a variety of ways in which we can engage patients. One is directly. Many of us work in healthcare facilities, and as patients come in, we can ask them to participate in our studies. Another way is to figure out where patients go. Aside from our own healthcare clinics, they attend churches or they attend other organizations. And those churches, those organizations will help us to find individuals who are interested in contributing information to help improve the health of the nation. People often wonder, when do we start engaging patients? Well, we need to engage them early and we need to engage them often. We need to engage them at the beginning as well as at the end. So when we're framing a research question, we need to make sure that patients help us to think about how they would phrase the question. That way it'll be easier to translate results in the end because we've come up with a question that patients understand. One thing we've noticed at University of Maryland is that there's a period called pre-engagement. That's the point at which we talk with patients about what research involves. A lot of times before a patient gets into an individual study, they have questions about what research is all about. And if we don't go through this pre-engagement period, they'll enter into a research study without really understanding the concept of research, and it's then harder to meaningfully engage them in the specific research project at hand. So we want to do pre-engagement, we want to do early engagement, we want to engage patients frequently. We want to make sure that in the end, we work with them to make sure that the answers are understandable for people like them. Usability criteria are important so that we all have a common vision of what we need to do to make sure that patient-centered outcomes research will be meaningful. It's going to be a long journey. We're starting that journey by developing straw criteria today, with the ultimate goal that eventually we'll have a set of criteria that patients, healthcare providers, researchers, and policymakers can all agree are the right metrics that we should use to make sure that when we do research, it will be usable, it will be informative, it'll be meaningful to patients and their healthcare providers. The last part of meaningful engagement is making sure that the data that we get is truly honest and informative data. If we don't engage patients the right way, they may not understand the questions and they provide us with data that's not accurate information. If we then use that information to make informed decisions in the future, they may be informed by that data, but they won't be the right decision. So we need to make sure that we collect data correctly and that we get accurate and honest information from patients in order to make sure that future patients make truly informed decisions that will improve their health.